The global coronavirus epidemic has led to the imposition of some of the most strict measures that we've seen in our lifetimes in terms of trying to prevent a global pandemic. And that's leading a lot of people to ask the question of whether or not the cure is worse than the disease, whether or not we're shutting down the economy for no particularly good reason, and whether or not there's this fundamental trade-off between economic growth on the one hand and solving a pandemic on the other hand. And you can just see that throughout the coverage that you're seeing in the news media. For example, here's the Federalist's Ben Domnech, he's the publisher. An article titled, "We're following a one-size-fits-all coronavirus strategy right into a Great Depression," saying that our leadership class responded to the outbreak of the coronavirus by shutting down the economy on a nationwide scale, and that this might mitigate the loss of life. It's clear that we're confronting a challenge no medical innovation can cure. We face an unprecedented situation, not a global pandemic. We've seen those before. But a modern capitalist economy that turned itself up offers potentially more than 60 days on purpose. While the shutdown has already done enormous damage, it is the uncertainty about how it will reopen that could prove far more destructive in the long run. This approach from Domnech, which isn't necessarily downplaying the crisis, but is instead suggesting that the economic consequences are going to be worse than essentially a worse consequence for human life than the public health measures would be. That's being echoed all over social media. For example, Jesse Kelly, just an hour ago, talking about in terms of wanting to make sure that we restart the economy as soon as possible. I am prioritizing lives. What do you think pays for all these amazing hospitals, doctors, nurses, ventilators, and medical ships? Money pays for those. Our economy pays for those. We need to make sure it stays running. Austin Peterson, a former libertarian presidential candidate, reopen the economy. The virus can't kill us all. We're better off taking a chance at the virus than with giving up any freedom, money, or power to the people least capable or interested in safeguarding it. You can hear the libertarianism a little bit there. Tom Fitton, the national shutdown needs to begin to end now. Our governments are strangling our economy. Begin to reopen with social distancing, with a link talking about how Macy's, the department store, furloughed the majority of their workers. And this Federalist piece argues that the number of people who will die deaths of despair from things like suicide and other consequences of being unemployed and poor, that those deaths will be more than the number of lives that are saved from the public health interventions. But is this really the right frame to be looking at this? What if, instead of being a net economic negative, the public health interventions are actually good for the economy? And rather, what if keeping the economy open itself is the actual worst thing you could do for the economy in the medium term? That's something that we haven't really thought about. Everybody's assumed that there's a trade-off between public health and keep economic growth. But what if instead it's public health interventions themselves that are the key to robust economic growth in the short term and medium term during a pandemic? This paper just put out recently from the New York Federal Reserve, "Pandemics Depress the Economy, Public Health Interventions Do Not, Evidence from the 1918 Flu." The abstract: what are the economic consequences of an influenza pandemic? And given the pandemic, what are the economic costs and benefits of non-pharmaceutical interventions? That's things like social distancing. Using geographic variation in mortality during the 1918 flu pandemic, we find that more exposed areas experience a sharp and persistent decline in economic activity. These estimates imply that the pandemic reduced manufacturing output by 18%. This downturn is driven by both supply and demand-side channels. Further, building on findings from the epidemiology literature, establishing that NPIs decrease influenza mortality, we use variation in the timing of intensity of NPIs across U.S. cities to study their economic effects. We find that cities that intervened earlier and more aggressively do not perform worse, and if anything, grow faster after the pandemic is over. Our findings thus indicate that NPIs not only lower mortality, they also mitigate the adverse economic consequences of a pandemic. Think about this for a second. What is this report saying, just in the abstract? And we'll look at the evidence. We'll go kind of a little bit further in depth in the report in a second. But what it's saying is that it's not actually a choice between public health interventions and the growth of the economy. Rather, what it's saying is if you don't have public health interventions and you don't get rid of the pandemic as quickly as you can, and you aren't aggressive, you hurt your economy. And that public health interventions actually help it. Well, why is that true? Think about it for a few seconds. What happens if there's a rapidly spreading global pandemic and that's not controlled in your area? Well, say you put in place a set of policies that says, whatever, there's an uncontrolled pandemic in our area, but we're not going to do anything about it. And you still, in the course of events, see overflowing healthcare systems, a lot of people dying of the disease. Photos like we've seen in New York of, temporary morgues being set up in refrigerator trucks. You see all these things. What ends up happening? Well, there's two dynamics. One, people don't show up to work, right? We're already seeing strikes with things like grocery stores like Whole Foods. People don't show up to work. They're not willing to work under unsafe conditions. And two, people don't want to buy things. People don't go to restaurants as often. They don't go to bars as often. So there's both a supply problem in terms of keeping your production lines open when people are getting sick, and a demand side problem, which comes from people being scared to go out and participate in the economy in the normal way. And that's completely separate from the question of what the government's doing or whether or not they're saying the economy is open for business. That's individual behavior in response to a contagious disease in their area. And that's what the evidence suggests. There wasn't some giant national policy during World War I about what to do about the pandemic. It was handled at the state level. And if anything, Woodrow Wilson, the federal government, were so focused on winning World War I that they weren't really putting in place national policies and trying to do something like what President Trump is doing. But that didn't stop individual states and localities from putting in place their own policies. And so we have this graph right here. If you can see this one, this is the graph. And it talks about how what does it say? Figure 1. The 1918 flu pandemic depressed the economy, but public health interventions did not. Dots represent city-level 1918 influenza mortality and manufacturing employment growth around the 1918 flu pandemic. Green dots are cities with intervention days above the median. So what that's saying is that these dots in green, Seattle, Oakland, Omaha, Portland, Los Angeles, and others down here, these are the cities that put in place early non-pharmaceutical interventions, social distancing, mask wearing, etc. And these cities saw, they saw obviously less deaths. That's true. But not only did they see fewer deaths, they saw a greater change in employment, more positive employment in between 1914 and 1919. Whereas conversely, the red cities, the ones that delayed and lagged in terms of putting in place non-pharmaceutical interventions, not only did more people die, as you can see, the red just generally pushes over, but also their economic growth was lower. So in reality, the consequence during the great influenza pandemic was to say the choice wasn't between public health interventions and the economy. The choice was between public health interventions the choice was between public health interventions and saving lives and saving the economy, or no public health interventions and having all three of those fail at the same time. So at the end, it's really not a choice. You want to have public health interventions if the pandemic is serious enough. And that's not just, you can look more at the data. It talks more about how the 1918 pandemic led to an 18% reduction in manufacturing output. That's extremely serious. And that the shocks were dramatic and elsewhere. But it's not just that. Let's talk about in anecdotes. There's a great book called The Great Influenza by John Barry, which is a detailed book not just about influenza, but also about the history of early American medicine. Not early, but the development of American medicine towards the turn of the 20th century. But one of the things it really does a good job of highlighting is just how devastating the flu and the Spanish flu was, and what it meant for not just how people behaved and the economy more generally. So to kind of advance to one particular anecdote, and let's talk again. The Spanish flu is happening at the very end of World War I when America's mobilizing. And I'll quote from the book now. In no industry did workers hear more about patriotism, how their work mattered more to the war effort, as much as that of soldiers fighting at the front than in shipbuilding, nor were workers in any industry more carefully attended to. And this makes sense, right? Think about it. If they're trying to win a war, they need to get a whole bunch of troops from America to the European theater. Shipbuilding is going to matter a lot. The government's going to care an immense amount about making sure that shipbuilding continues. Back to the book. In all plants, common drinking cups were immediately destroyed, replaced by tens of thousands of paper cups. Hospital and treatment facilities were arranged in advance. Influenza vaccines supplied, and it was perhaps the only industry in which nurses and doctors remained available. The reason for this is that most of the nurses and doctors were essentially brought into the military to take care of the troops. As a result, claimed a public health service officer, there is no reason to believe that many men were absent from work through panic or fear of the disease, because our educational program took care to avoid frightening the men. The men were taught that they were safer at work than anywhere else. They were also, of course, not paid unless they came to work, but at dozens of shipyards in New England, the absentee records were striking. At the L.H. Shattuck Company, 45.9% of the workers stayed home. The George H. Gilchrist Yard, 54.3% stayed home. At Fruitport Shipbuilding, 57% stayed home. At Groton Iron Works, 58.3% stayed home. What happened? In the most important industry in the economy of 1918 to the America, the one they focused on the most, the one they wanted to ensure continued, you had absentee rates, almost 50% of employees, absentee rates, people not showing up, despite the fact that they had nurses on staff where they couldn't get nurses anywhere else, despite the fact that they had they were doing everything in their power. They were getting absentee. What do you think was happening in the rest of the country? Huge absentee rates. People were terrified to go outside because people were dying. They didn't want to get sick, and they stayed inside. That's the anecdote that demonstrates why the data in the previous piece, in this piece that just came out recently, is correct, right? Why is that? Why does that make sense? The economy stalls not because of what the government says, stop doing things, shut down your economy. The economy stalls because you have a decrease in supply and a decrease in demand when there's a rapidly spreading global pandemic. That's what happens. So, what are we facing right now? So let's talk about the current virus statistics, right? So this is the latest stats as far as I can tell. We're at over 200,000 cases in the United States, over 11,000 new cases so far today, April 1st. And new deaths. We're almost up over 4,000. And I mean, it's really dramatic when you go and you actually look at the rate of growth. I mean, remember, as late as March 16th, March 17th, 2 weeks ago, there were only 5,000 confirmed cases in the United States. Now we're looking at 200,000. 2 weeks ago, March 16th, there were a total of 87 deaths. We're now up above 4,400. These numbers are scary to people. They're scary. It's natural to be scared. And I mean, there's a reason that President Trump yesterday did his video where he was, or not did his video, did his press briefing rather, where he talked about how we are facing maybe 100,000 deaths in the best case. He was getting in front of the news to try and explain how bad the next 2 weeks are and why he was implementing such aggressive measures. So you might say, well, President Trump's modeling is wrong, everything's wrong, but we should just go right back and reopen the economy and go back to work. It's like, but will that work? Like President Trump simply changing his mind? It's not obvious that it will. And to understand why, let's look at actually what the polling is saying about how people feel about the coronavirus. This is, a poll that just came out today. This is conducted March the 29th and 31st, last few days. Margin of error 3%, 1,500 adults. Economist YouGov is generally well regarded. Let's go down to question 13. Taking in consideration both your risk of contracting it and the seriousness of the illness, how worried are you personally about experiencing coronavirus? 24% very worried. 41% somewhat worried. Only about 34% are not really worried about it on a personal basis. But that's 64% of the public worried about getting coronavirus in public. Do you think those people are just going to snap their fingers and start going to restaurants and bars because the president says they're to do that? No. Do you think that people are going to willingly go to work in places where they're worried about getting the disease? No. People are going to want to do social distancing. There's a lot of other things in this polling that are really pretty interesting. For example, question number 16, do you plan on traveling anywhere the next 3 months? Only 15% say yes. Number 17, how much longer do you think the current situation with the coronavirus outbreak will go on? Only 25% think it'll go on about a month. 47% think several months. That's a lot more that people think that this is a long-term thing. Number 18, perhaps the most important in the context of are we making this huge trade-off between opening the economy and protecting public health. When do you think it will be safe to end social distancing measures and reopen businesses as normal? Only 4% of the public thinks it's safe to do so right now, and only 6% of the public thinks it's safe to do so within 2 weeks. 30% of the public thinks it'll take about a month, which is what the president said, until May 1st. And then 37% think it'll take even longer than that. 5% think it'll take even more than a year. Only 10% of the public thinks in the short term we could reopen the economy. Now, that might say, well, whatever, the public's wrong, we should reopen the economy anyway. But these are the people who you're expecting to go out and purchase things, to go out and go to work. Reopening the economy, this is not a command economy. We're not communist Cuba. The government can't force people to go to work. The government can't force people to buy things. We are dependent on voluntary demand and workers voluntarily being willing to go to work. And the evidence suggests that they wouldn't be willing to go to work even if the government decided to just abandon. The same way they weren't willing to go to work in 1918 when the government was insisting everybody go to work for World War I. How many, more numbers. How concerned are you about a coronavirus epidemic in the community where you live? Very concerned, 27%. Somewhat concerned, 45%. How concerned are you about an epidemic here in the United States? 52% very concerned, 35% somewhat concerned. So 87% of the public, at least somewhat concerned about a United States epidemic, and only 13% just not concerned at all. How would you describe the way most Americans are thinking about it? 49% say we're not even taking it seriously enough. Only 15% say we're overreacting. This is not a public that is just going to rapidly go out and go spend in the economy, go back to work. The public needs to see that the virus has been beaten, which is why Trump is saying things like we need to ride it out. And here's the thing. Here's another point. Do you think the virus will lead to an economic recession? 61% say yes, only 11% say no. Most people think this is going to lead to a recession. Almost half the public thinks we're currently in a recession, 49%. Now, let's go down a little bit more to see how people think about how Trump's doing things, given that 61% of the people think that what Trump's doing and the coronavirus will lead to a recession. 34, do you approve or disapprove of Donald Trump's handling of the coronavirus outbreak? 50%, 28% strongly approve, 22% somewhat approve. It's 50-42 in favor of the way Trump's handling it, despite the fact that 61% of the public thinks we're going to end up in a recession. This is a different environment. It's a wartime environment. People want to see the government take aggressive measures. They are not confident that they will be able to go out in public and avoid the virus, and they know it's serious, and they want to see the government take it seriously. The idea that there's a trade-off between the economy and public health is wrong. The economy comes back when we beat the virus. The economy comes back when we implement public health interventions and force the curve, not just flatten it, but kill the curve, suppress it, hammer the curve. Once we do that, then we'll be able to have a normal economy. It is utterly tragic that so many small businesses are having incredible difficulties. Many are likely going to go bankrupt. Many people are going to be out of work in the short term. But you can't just wave a magic wand and restore those. Those are caused not by the government's actions shutting down the economy. That economic loss, that's caused by the fact that there's an currently uncontrolled global pandemic that is keeping people rationally in their homes. That's the problem. And that's ultimately what you need to fix in order to fix the economy. So that's what I have for you. Again, I want to close with one thing, a line from the final line of the Great Pandemic. Those in authority must retain the public's trust. The way to do that is to distort nothing, to put the best face on nothing, to try to manipulate no one. Lincoln said that first in bed. A leader must make whatever horror exists concrete. Only then will people be able to break it apart. Can't pretend, can't sweep this one under the rug. We have to beat the virus, and then we'll restore our economy. Thank you.